Welcome back, STEM Swag Squad. As you know, I'm your host, Temple, and welcome back to the podcast. Today, we are getting into the medical profession. I'm connecting you with Physician Assistant Renee Thomas. She is passionate about helping others, which was the driving factor to her becoming a professional in the medical field. She studied microbiology, public health, and has even worked as a laboratory scientist with the CDC. Today, she specializes in urology, which I'm so excited to hear about. Please welcome to the stage Miss Renee Thomas.
Good morning, Temple. Thank you for having me today.
I am so excited for you to be on here and for me, as well as our audience, to learn some new things about what you do.
Great, and I'm excited to share.
So, my first question is, what's the path to becoming a physician assistant?
Okay, so to become a physician assistant, you will need to complete your undergraduate degree, so 4 years. And then for the physician assistant pathway specifically, you have to have patient care hours, meaning that they want to know that you've interacted with patients, that you have been exposed to medicine, that you have been exposed to physician assistants, and you know exactly what you're getting into. For a program like Emory, it's usually 1,000 plus hours. So from there, you would go to a school of medicine that has a physician assistant program. In my case, I attended Emory University School of Medicine's physician assistant program. It's a 3-year program to become a physician assistant and then pass the board exam to actually practice and become a certified physician assistant.
Okay. So now that we know what it kind of takes for you to become a physician assistant, also shout out Atlanta. I love shouting out Atlanta when I have guests on here because someone's always connected to it. But what is a physician associate assistant? What exactly is that now that we know the path to getting there?
Okay, and I wanted to just clarify one thing, and I'm glad that you kind of went and interchanged between assistant and associate. Previously, we were physician assistants, but in the last year, we voted as the American Association of Physician Assistants to change the name to associate. So you'll see it interchange because it's such a new thing that you will see assistant written, but we're moving towards associate.
Oh, okay. Thank you for that information because I read it and I was like, but I thought it was an assistant. So that's really cool that it's just recently been changed. What was the reason for the changing?
I think it was just to clarify what our role is. Because as a physician assistant, we are certified to practice medicine, so we can diagnose patients, we can treat, we can write prescriptions. I think associate probably just made it seem more of a team, like a teamwork type of thing versus like you're assisting because you stand alone and have a lot of autonomy in practice. So I think that was some of the driving force to it being changed from assistant to associate.
Right. Okay, I got it now. Is a PA is kind of the what you would say when you don't want to say the full thing. So is a PA basically a doctor? What type of what is the specific thing that I say, oh yeah, this is my physician associate?
Okay, so no, a physician assistant is not a doctor. So you have 3 people that are can actually practice medicine in the United States, and so that is a medical doctor, a physician assistant, and a nurse practitioner. And
Mm.
so, as a physician assistant, we again have autonomy. So if you came in Temple to see me, I would be your provider for the day. Okay.
Oh,
The difference is obviously with the medical doctor, they go to school for a much longer period. They also do a residency that's much longer than physician assistants who choose that route as well. So it's a longer, more extensive training with the doctor, but we follow the same models that doctors do in terms of training because we're under the School of Medicine. But again, I can still diagnose, see my own patients, decide on a treatment plan, and then prescribe medications or whatever plan we think is best for you, whether that's behavioral changes. So,
okay.
yes, just another member of the healthcare team that can help alleviate the number of patients that have to be seen.
Okay, so a physician assistant, Is the only difference between that and an actual physician, an actual doctor, just the time going to school?
Yes, I think that that is one of the major
Mm.
differences because, of course, again, like I said, they have a longer, extensive training period, and we get trained as well. However, if we have a question, we would defer to our doctor if there's something that we need to discuss and run by them, and we work alongside, but they are our supervising. The supervising physician that we work
Okay.
aside with, kind of under, but they like to say, and we like to say, work alongside with.
Yeah, with. Okay.
Mhm.
Now, you say it goes actual physician and then a physician associate or assistant and then a nurse practitioner. What's the difference between a physician associate versus a nurse practitioner?
So it is, we both again are certified to practice medicine. However, they follow the nursing model, whereas again, we follow kind of the same medical model that a doctor
Oh,
um, goes through because nurse practitioners go to this nursing school programs, and we again are under the School of Medicine.
okay, I got it now. There are a lot of different levels to the medical field. And I know, as I talked about in your intro, you've done many different things
Mhm.
within STEM. Why did you change from studying microbiology to becoming a physician associate and then doing lab work at the CDC? What was that change? What made you want to change your mind and be like, this probably isn't for me, or oh, let me try something different?
Yes. So I'm a lifelong learner, and I think everything is about exposure. And so when I was in undergrad, I was actually pre med at the time, microbiology pre med. And I got into research during that time. And a book came out that was instrumental that kind of shifted my path from medicine. And that was The Hot Zone. So it's kind of like when we had the Ebola scare. That happened years ago as well. And so I wanted to work at the CDC. So I kind of followed that route. Got recruited out of the CDC to become a pharmaceutical sales rep. So that was my exposure to PAs because when I was growing up, and this is why I'm so excited that you're doing this, that young ladies and young men, like they can learn more and be exposed to different professions because I always heard doctor, doctor, doctor. I didn't have any
You
real
didn't know
idea
anything else. Yeah.
PAs or NPs. So as a pharmaceutical sales rep, that was my exposure when I would go in and talk about my medications and what diseases they could treat. I got to see and learn more about the physician assistant associate and decided that, you know what, I kind of more interested in talking to them about their patients. And I always wanted to practice. So what can I still do at this older age? And decided that this was the route for me, and it was the best decision I ever made.
Yes, yes. I'm so glad that you brought the exposure piece up because the whole like thing for my podcast and for my movement is creating exposure so that youth, especially Black youth and especially little girls, they know that there's more out there than just the regular doctor or the regular astronaut. That there are things that goes deep. Every single career has a niche, and you can find your niche in those careers. So I'm happy that you talked about that to know that there's way more out there than just being a pediatrician or something else. Now, how did each career that you held help you with the other one?
So I think that you build on things. So when I was a pharmaceutical sales rep, I was able to learn about medicines, understand disease states. So making this transition was pretty easy. And then when I got there and I was in school, there were things that I was already an expert in because of my past careers. Even reading studies. So when I worked for the CDC and I got my degree in public health, understanding like which studies actually support like the treatment plan or things that you're sharing with your patients. So to tell them that, this is clinically relevant, that this there's data that supports it, and understanding and being able to talk the language from my past career as in public health.
Okay. So, what was the school life like? I know I went to a summer camp at Emory where we had to do stuff learning about cancer cells and learning about health. And Emory and the CDC are really connected too. I've been to multiple times where I had to go on a field trip to either one of them. So, what was that kind of school life balance to get you to where you are? Especially, did you have connections from going to school at Emory to going to the CDC?
So yes, because when I was in the School of Public Health at that time, we had professors that had connections or worked at the CDC. So that was the way in. I actually was a fellow immediately outside of graduating. So I worked for a year within the CDC. But I
Wow.
think in life, it's all about connection. So with you doing this, your audience is going to get exposure where they can reach out, ask about shadowing experiences, start building their network because you do need a network with some of these career paths to get in, some of these jobs, especially with the CDC. Making connections is very important. I think that it's very important to build a network, start
Mhm.
making your connections because it always helps you. So you have like your resume with all your accolades, but you need that extra push sometimes by someone on the inside to say, hey, I worked with her, or this is my mentee. She's going to be great. Can you take a closer look at her to get your foot in the door?
Absolutely. I really, and whenever I talk to professionals, whether that's a STEM profession or just people in real life careers, those connections that they make with people along the way has helped them get into rooms that they couldn't have just gotten in if they were just smart or if they had just done so and so. You have to meet those people along the way that have access to bigger rooms and bigger doors that you couldn't get in on your own, which I think is so important. And I hear that all the time. So, guys, networking, when even if it's doing something that you don't actually want to pursue when it comes to a career, maybe you'll find those people in another way and learn how the career you actually like can help out with what they do. And just meeting people along the way is so important. So what is the typical day at work for you? What are you doing on a Tuesday at 11 a.m.?
I am usually in the operating room on a Tuesday at that time. So I've been a urology physician assistant associate for the past 8 years. Just shy of 2 years, I was an interventional radiology physician assistant, but I love and am passionate about urology. So I went back home and
Really
that's
quickly,
where I
go
am.
into what urology is.
Okay, so urology is the study of diseases and conditions of the urinary system and male reproductive health. So, such things as kidney stones, kidney, bladder, prostate cancer, just the gamut of anything that can happen in those arenas. So, the disease and the conditions of the urinary tract and male reproductive health. So, my typical week is I work 4 days a week, Monday through Thursday. I do clinic on Monday, Wednesday, Thursday. And in my role in coming back to urology, I'm now in the operating room. So on Tuesdays, I first assist with robotic cases.
Oh,
So I do that. And then on Thursday morning, I assist one of our surgeons that does open cases. So, yep, that's kind of my day. And then I go back to clinic. But I see new patients, follow up for anything that can happen in the urology arena.
what got you into urology?
So when I went to school, I thought I was going to be in infectious diseases or orthopedic PA.
Ooh.
And what happens is you have core classes that you take in as a during the PA program, and then you have 3 electives that you get to pick. So I decided to do 2 orthopedic electives, and then I said, "Oh, what do I want to do for my third one?"
Uh-huh.
And I liked OB, but I knew I didn't want to do that. So one of my classmates, she had a background in urology and was like, you know what? I think you would kind of like urology. I think you should try that. And I did that rotation, loved it. So I knew I wanted to be in a surgical subspecialty, which urology is, but it's the perfect mesh of medicine as well because there are disease states that don't need surgery. So you get this hybrid of both surgery and medicine that I love.
Okay. So because I know that you went to school for medicine, so clearly you've always kind of had an interest in it. When you were younger, what made you really interested in medicine and STEM?
So I think that I would say even more so than medicine, it was science for me.
Mm,
So I just always, I love discovery. And for me, when summer programs similar to what you talked about came up, and I remember I was in maybe sixth grade, like an opportunity to do a summer program that had dissecting. And, my friends, when they're looking through it, are like, ew, that's going to be gross. And I'm kind of like, this sounds like it's going to be interesting and cool. And I think from there, I was always good at science. Things interested me, like, you know, bacteria and why and how this tiny little thing can wreak so much havoc and why does this happen. And so for me, I think that that was one of the things. And then I didn't know, did I like the laboratory side? And I guess I figured that out because then I ended up doing public health, but still came back to medicine because I like interacting with people. I like making a difference in people's lives when they're most vulnerable. So I think it was just that I always had a love of science that led me into this path.
yes, I'm so happy to hear that because I think it's really a push of curiosity that kids who love science always have and want to answer for why and how and what. So it's really interesting to hear you say that and just know that you've always been interested in this. Being interested in being a little Black girl and then growing up and being a Black woman in STEM, what challenges have you faced?
I think that I've just been fortunate because, like I said, there have been networks that I've been able to build for myself. But I've seen other people's journeys who haven't been exactly the same. Okay. Because, again, this is why I'm so excited to be here and that you are doing this. So people get exposure, they get a name that they can connect with. And even sending a message, you don't know from this show who may reach out to me. And then in 4 years, I'm saying, hey, I'm writing this letter of recommendation. They built this network through your podcast. So for me, I think that I haven't had as many challenges, but we know what comes with our community. And what I've seen is that we have to work harder. We don't always feel like we have a place. We don't always feel seen. And that's because they have, like, everyone hasn't had this exposure to build the same network to help them understand that you are supposed to be here. You are smart enough to be here and those types of things. So I feel like I've always had mentors that kind of pushed me along and told me these things that made me feel confident that I don't feel like I've had some of the challenges that I know that we can face, especially as Black women in medicine.
Yes, absolutely. That was really good advice. And I know everybody's story is different and depends on where you start and when you start and who you meet. But we face many challenges that are personal or societal. So it's really important to hear that. But moving on, it's time to play a game. I told
Okay.
you a little bit about this earlier. We are going to play show and tell.
Okay.
So, for the game, I'm going to show you a picture and you're going to tell me a little bit about it. Okay?
Okay.
All right, let's start off here.
Okay, so that picture is when I graduated from the Emory Physician Assistant program, and I was their first recipient of the Student Leadership Award that's voted on by peers and faculty. Very proud moment.
Yes, absolutely. How did you feel in that moment? Did you give yourself a little hype up? Be like, yes, I made it. What was that
Yes, I
feeling?
did. I was like, yay, I made it. That program is not for the faint of heart at all. But I was so excited that I completed it. And then to be acknowledged by your peers is always a good thing. It's one of those pick me uppers, the things that make
Yes,
you just feel good inside.
absolutely. I love that. All right, picture number 2.
Okay, so that is when I left urology after 7 years to go and try something different. And then I went to interventional radiology at that time, which I learned a lot of skill sets there. But I'm back, right back at that where that picture was taken, and happy.
What made you go back?
I think that I always kept a connection with the people that I worked with. So we were always kind of staying in touch. And as time went on, I was just like, I like interventional radiology, but I love urology. Prostate cancers is one of my big passions, or one thing that I'm very passionate about. So I missed a lot of my patients. I missed my team there. And so I was very happy to return to what I love.
I'm glad you're back to what you love. All right, I'm gonna show 2 more pictures.
Okay.
Let me choose which one I want to see.
Oh, that's me as a little kid in New York City. So I'm originally from Jamaica. I moved to the United States when I was probably a year old. So this is where most people go when they first get here, and that's in New York.
How'd you get from Jamaica to New York to Emory? So that's
okay. Yeah, so moved around with my parents. So my parents came to the US, and so I went to New York. Then with job transfers, we moved to Texas, moved back to Maryland to be closer to family, and then landed in Georgia, which is where I tell everyone is home because this is where I've been the longest. But it was kind of like job transfers or being closer to family that had my parents moving. But yep, Georgia is what I claim as home.
Georgia. Yes, absolutely. All right, well, that was actually my last picture. And I have one more question before we leave out, and I think this is really important for anyone out there listening. What advice do you give to your younger self?
The advice that I give to my younger self is, just live your life and find what's going to make you happy. Yeah. I think that I've been fortunate and blessed to have the parents that I did that allowed me to have different exposures and experiences that led me to this day. But I think that it's just like live life and find what's going to make you happy. And whatever that is, do it and do it in excellence.
Yes, absolutely. That's really important for anybody out there to hear. I mean, you could still kind of accomplish that as an adult as well. So it's just good advice overall. Now, Miss Renee, before we leave, there's one thing that I get all my guests to say on the podcast because, as you know, I created STEM Girl Swag to show that science is cool and fun. You can be a girl and interested into it, but it just doesn't, you don't have to have that persona of being a nerd that likes science. So, for the audience, can you please say STEM Girl Swag?
STEM Girl Swag.
Yes. Thank you so much for joining me on my podcast. You can connect with Ms. Renee on LinkedIn because if you're a kid and you don't have LinkedIn, if you get it, that's how you can find some really good people and stand out. So thank you so much for joining me.
Thank you for having me today.
Thank you. As you guys already know, this is the STEM Swag podcast, and I'm here connecting you with the coolest people in STEM. So for more information, follow me on IG at Just Temple. Go to the website and subscribe, like, and comment. I'll see you next time.